Today is a labor market forum for the healthcare sector, and it's really been driven by the fact that we are hearing more and more from local healthcare employers that they are struggling to fill shifts. And that's in a variety of fields, personal support worker, registered nurses, registered practical nurses. So as a college, we wanted to bring together all of these groups and have a conversation and build some strategy around how do we collaborate to make sure that we can address those labor market shortages.
I think it's very important for organizations to talk and share ideas. The more heads around the table, the more we can come up with solutions. So I think that's always very beneficial. And we all kind of draw from the same pool of staff and workers. So the more we can work together, the more we can try to solve those issues that they're having. We're talking at the table about transportation and how that's an issue, and is there a way that organizations can maybe look together and try to solve that problem. No one organization can solve that problem, but if we all pool our resources and work together, maybe there is a solution to transportation. I know for a lot of millennials, they're struggling with daycare, the cost of daycare. So is there things that we can do if we group several organizations together and pool our resources? Can we come up with a solution there? So I think it's very important that we do this.
I definitely see value in it. For one, at the table level, I'm meeting other businesses that we can collaborate on, we're brainstorming, but on a larger scale, it's to feel like you're contributing to, you're offering suggestions or you're participating in potentially solving a problem that we are all struggling with. So I see value in participating in an event like this.
Change is inevitable, and generational change, the emergence of millennials and even Gen Z is forcing change in the workplace. Healthcare is not immune to challenges of recruiting skilled and engaged employees. That's the key word, it's engaged. You can find lots of people, but if you bring them on your team and they don't work very hard or they aren't excited about the work that they do, they're probably not going to last very long and they're going to look for other opportunities. And so the real challenge is filling these jobs. Because millennials make up 40% right now of the workforce, going to be 50% in a few years, you have to be a place that I think thinks about how they're different, embraces that difference, and then starts to make the changes, subtle even sometimes, that when a young person walks through the doors and starts working in your workplace, they feel that this is a place that works for them. And the ultimate goal of creating an inclusive workplace, which is not just a buzzword, it actually works.
Working in silos, we often feel isolated in our problems, but we really aren't. I think that bringing together this diverse group, people from different parts of the region doing different types of work, and comparing what we do in the community really highlights how much work is actually being done already. And I think that provides a lot of relief for people who are on the front lines dealing with these workforce shortages.
We are actively recruiting almost around the clock. We have opportunities for registered nurses within a variety of different departments there. Every time the hospital grows, we look for clerical staff to support some of the growth that we have for different departments. So we're looking for medical radiation technologists as well that help support the different developments that we have going on, as well as physiotherapists, occupational therapists. So we offer a lot of services that hospitals and urban centers would offer. So we look for almost all trades within the healthcare sector.
I think ultimately what we want is we want our community to be vibrant. And to be vibrant, you have to have core sectors having a sufficient labor force to do so. And healthcare is the backbone, as is education in any community. Those two sectors are combined in this challenge. One, education has to respond and be able to encourage young people to look at healthcare careers and to get the training required to work in those fields. And the healthcare sector needs to have a labor force that can make sure that we take care of people of all ages, but particularly the long-term care sector because of the shortage of personal support workers.
We most definitely will have to reach outside of our community to help fill a lot of these positions. There are not likely going to be enough people within the county of Renfrew to take up all the positions that are being vacated by people as they start to retire, the baby boomers as they start to leave the workforce. We all have to recognize that there's the changing demographics lead to changing cultures. And we really have to get together in identifying what it is that we need to do collectively and collaboratively to help make this area an attractive place for people to come and live. Message this morning, it was mentioned that people still, one universal constant is that young people as they grow up and start having families want to buy homes. Well, in Renfrew County, houses on average are about 40% less expensive than a comparable house in the city of Ottawa. I think it was 70% less than the cost of housing a comparable house in downtown Toronto. You know, it's there's a lot of great reasons why people should come or would want to come to an area like this.